needs, their emotions, and their thoughts.
Okay, Mr. Safra, actually, how can a person get out from anxiety or depression if someone finds that he has anxiety or depression with any reason? There can be so many reasons behind that. But if he comes to
Yes.
you and asks you that, I have these kind of scenario, and how did you find out that he has anxiety or a depression? And can a person get out from these things?
All right. Thank you for asking that question. Yes, anxiety and depression, you can come out of these things. They are
Hmm.
not for life. And
Okay.
when they comes to me, if they are already aware about their symptoms, then obviously it gets easy for me
Through
to
medicine
work on the
or through
intervention.
counseling?
Yes,
Through medicine or through counseling?
through counseling. I am a
Acha,
psychologist, so my
acha,
main focus is on the counseling. We do
okay,
not provide medicines until and unless we are licensed to do so.
okay,
Okay,
okay.
so that's also very important to clear that. A psychologist cannot prescribe you medicines.
Hmm.
That comes under the category of psychiatrist. And
Hmm.
obviously, a psychiatrist is a doctor. They have done MBBS, and that's completely a different field.
Hmm.
So I focus on the counseling. And the counseling is all about having the conversation with the client. It's all about how are you going to let the client open up to you.
Right.
When a client comes to me, as I was saying, when a client comes to me, and if he is already aware about the symptoms, then
Hmm.
obviously it gets easy for me. I just have to work on the strategies and I have to,
Hmm.
tell the person different techniques and exercises that how he
Hmm.
can work on the anxiety or depression.
Hmm.
But sometimes they're not familiar. They're not aware of it.
Hmm.
They're not sure that what is happening to them. So for that, we do have assessments. We have
Hmm.
formal assessments as well that helps us to easily identify, they can rank their emotions or feelings from 1 to 5. Like, I don't feel like doing anything. I've lost my appetite. I don't enjoy things that I used to enjoy anymore.
Hmm.
So these
Hmm.
are different types of questions that
Hmm.
comes under the formal assessments. But it's also important that you have to observe the client as well,
Hmm.
because sometimes the formal assessment do not say what the behavior of the person is saying.
Hmm.
So we also have to focus on the behavior of the client as well. We have to observe that. Coming to the question that how they can come out of it is that it's not only about how do they feel,
Hmm.
because it's easy for a client to share their feelings that,
Hmm.
I'm feeling scared, I'm feeling anxious, I'm
Hmm.
feeling like I don't want to go to that place.
Hmm.
Suppose a
Hmm.
person comes with the social anxiety and he
Hmm.
says that I don't like to socialize with people,
Hmm.
right? Why do you not like to socialize with people?